Hello, I'm Woodrow Wilcox. This is the Office of Senior Care Insurance Services in Maryville, Indiana. And with me are Mr. Adalbert Bozarnik and his wife, Gloria Bozarnik. I've asked them here to explain a problem that they're having with the Veterans Administration and how Veterans Administration treats our senior citizen veterans. Mr. Bozarnik, how long were you in the service, and which service was it?
I was in the U.S. Navy for 4 years.
Okay. And you've recently had some medical bill problems with VA clinics, is that right?
Yes, sir.
And your wife has been handling the bills and writing the checks, is that right?
Yes, sir.
Mrs. Bozarnik, could you please explain to us in a nutshell what the problem has been with the Veterans Administration and the billing and your payments and all the problems there? Could you explain that to the folks?
Yes, thank you, Woody. My husband has been seeing the VA medical for about a year now, and we've incurred some costs, but I've been paying them monthly as we could. We only live on his Social Security and mine. And I called them and tried to set up an installment plan with no response, but I kept making payments every month and keeping track of the dates and the check number and the amount of money that I sent every month. This month, July 2nd, he received a letter from the Department of the Treasury stating that they are going to withdraw money from his Social Security on a monthly basis starting August 9th. I called VA, the number that was listed on there, and talked to a Kevin. He stated that the reason they're charging us and going to withdraw that money is because that's money that we owed from way back last year, which we never received a statement for. The last statement I received was, before this one, was for $306.16, and that was in June. I sent them a payment July 6th of $306.16. Now I have received another bill that didn't even exist until June 30th of $1,113.45. And we did not have that bill until June 30th.
So let me understand this correctly. Your husband has had services at VA health clinics, You've been getting bills. You haven't been able to pay it off all at once, but you've made payments. The last time you made a payment, you got a bill for $306.16, and you paid $306.16.
Yes.
And then you get a letter from the Department of the Treasury saying that because you didn't pay, they're going to start deducting from your husband's Social Security, even though you have paid. And then you call Veterans Administration, they say, well, it's for back amounts that you owe. And then you get another bill, but the bill even shows that the amount they're trying to collect is from a new charge from, looks like June 30th of this year.
That's correct.
So Veterans Administration doesn't even know what they're trying to collect on you for.
Right.
But they've sicked the U.S. Treasury on you, even though you've been paying.
Yes.
Even though it was a large amount before you called to try to set up a payment plan, and you've been faithfully paying off month by month until you got it down to zero as far as the bill said.
Right.
And then they sick the U.S. Treasury on you for a new amount.
Right.
And that's the situation you're facing right now, right?
Yes.
And they're going to start deducting from his Social Security next month. Is that correct?
Yes.
Right.
And all you and your husband have to live on are your Social Security checks.
Yes.
Okay. Is this the way to treat a veteran of the United States Navy or a veteran of any other service? I think not. Also, I ask these people in here to explain their problem. They're being mistreated by the Veterans Administration, and the Veterans Administration sicked the U.S. Treasury on them. They're senior citizens living on a limited income. They have worked faithfully to pay off their Veterans Administration clinic bills. And I've got another question. Why do we even bother to bill our veterans for their medical needs? Why are we billing them when they served our country? I have a big problem with that. But I also want folks to know we have similar problems with Medicare Part D that we handle at this office. Medicare Part D, we have a lot of clients who come in with letters saying that the U.S. The Medicare, the Social Security did not deduct their monthly premium for their Medicare Part D for multiple months, and Social Security didn't send the money to the insurance company. So now the insurance company is billing our clients for amounts that they already paid through Social Security, which Social Security never sent to the insurance company. And our clients are getting bills for $1,600, $1,800, $2,200, $3,000 in back payments for premiums for Medicare Part D because Social Security has not been sending the money to some of the insurance companies. And we've got problems with bureaucracy trying to handle the health care of our senior citizens and our senior citizen veterans. I have a question. If the federal government takes over all health care, won't we all have the same kind of problems? I want the problems that exist now to be straightened out for our senior citizens and our senior citizen veterans. That's where our focus should be in our country, to straighten out the problems that we have now with the federal government trying to handle their health care. Let's fix those problems first. That's my opinion. And I want to thank Mr. and Mrs. Mazarek for coming in today, for letting me help them to make an appeal to Veterans Administration. If anybody at Veterans Administration is watching this, and you can help to straighten out this mess for Mr. and Mrs. Mazarek, please call me, Woodrow Wilcox, at Senior Care Insurance Services, area code 219-736-9450, and I will get your contact information and have Mr. and Mrs. Mazarek help you, or contact you to get help from you. And again, that phone number is 219-736-9450. I'm trying to help Mr. and Mrs. Mazarek straighten out this problem so that it gets straightened out before the U.S. Treasury starts taking money out of Mr. Mazarek's Social Security check.